Assalamualaikum. We are from Group 2. We will present our assignment 2, Health Promotional Tool, which is the flip chart with the target community, diabetic patients without diabetic retinopathy. This presentation includes evidence of the problems, reasons of choosing tools, features of the tools, strategies of implementation, aims of introducing this tool, expected outcomes, and the potential benefits.
For the evidence of what are the problems that we found in our previous screening on assignment 1, the first problem that we found are subjects are not open to what is diabetic retinopathy, DR. From the result of their screening, the vast majority of subjects enrolled have never heard about DR, is 49.5%, while another 14% are not sure on what is DR. This gives a huge main problems that come out from previous screenings. Other problems that we found are 59.8% of the respondents did not know the symptom of DR, which is more than half of the total respondents. Next, greater number of subjects are not physically active person, which is 61.7%, and only 21.5% did not know the high cholesterol level can lead to DR. Same goes with high blood pressure and blood sugar level. 22.4% and 2.8% respectively did not know this thing can lead to DR. Hence, only 32.3% did not have other related health problem, while the rest suffer from other diseases such as hypertension. All of these are the risk factor of DR. 44.9% subject also stated they did not know the effect of DR, and for the treatment option of DR, only 22.4% know about this, while the rest is not sure and did not know the treatment option. On the other hand, the eye screening awareness gave a limit result, which is only 16.8% of the subject did an eye checkup. On the other hand, the eye screening awareness gave a limit result, which is only 16.8% of the subjects did an eye check in the past 1 month. Compared to the rest, 83.2% had an eye check in the past more than 1 month. Hence, we must educate them the importance of frequent eye checkup among diabetic community. Based on all of this evidence of problems, we have come out on a problem-solving content to increase education on DR, give a valid information on DR, and enhance knowledge on DR. The example of useful information that can be included in our tool are definition of DR, sign and symptom, the risk factor, the treatment option, and the awareness of eye checkup. Last but not least, based on the result of screening on DR, the total 60.7% of respondents had a duration of diabetes is less than 10 years, which has lower risk to have DR. Thus, we are in accord to choose the target population for our tools is diabetes patient without diabetic retinopathy.
We are planning to do a flip chart which can be used by ophthalmologists, optometrists, and other general health practitioners to educate patients about diabetes. The reason why we choose this type of health promotion tool because many of the participants in our previous questionnaire did not know much about the diabetes and also the diabetic eye problem such as diabetic retinopathy. In our previous questionnaire, we also provide several links to social media, which is our platform to provide them general knowledge on the diabetic retinopathy. But this alternative to spread the awareness does not have much response from the participant. It is because our participants are above 40 years old and some of them do not have and use any social media, while some of them who have social media seems to have no desire to know about the diabetic retinopathy. This shows that it is hard for us to spread awareness virtually. Alternatively, promoting health education by qualified personnel using this tool might be more effective to better reach the community and educate them about this. The other reason for choosing flipchart is because there are more advantages of using flipchart. One of the advantages is that it is more attractive and easily to understand for older patients. It is because the flipchart consists of a simple point which can make them clear and not confused on any complicated sentence in it. Thus, as the physician is going to assist them on the flipchart, it will help them a lot in understanding every point of content that we are going to deliver in the flipchart. Other than that, it also enables the physician to cover a huge amount of information in a short time. It is because the flip chart mostly consists of a picture together with a simple point, which enable the practitioner easily deliver any point without reading a long paragraph, which make them more hard to find an important point. Next, it is also an inexpensive method which does not need the patient to pay the cost of the education, as our flip chart targeting the diabetic patient without diabetic retinopathy, meaning that the information in this flip chart mostly targeting people with diabetes, as they go to the hospital to get their annual health checkup, and the consultation for them can be given by presenting the idea using the flip chart. Lastly, the flip chart is also easy to use, which the patient only need to flip it from page to page. As we compare it to the online method, using flip chart can be said to be more easier. It is because most of the diabetes patient is the people at the age of more than 40 years old. Not all of them know how to use gadget and how to find the information online. By using the flip chart, they can read easily by their own without any technical error.
So for the features of the tools, basically we want to know how does the flip chart looks like. First, it consists of pad paper sheets combining visual label graphics and easy to read text. It is very helpful for the examiner to provide a patient with an explanation of a disease when using this tool. Second, the size of the flip chart is smaller than the A4 paper, so it is easier for the examiner to take it anywhere for educating the patient at any time. The third one is the information provided is simple but lot of knowledges. So it is easier for both examiner and patient to understand during the consultation session. So then, the fourth one is the flip chart also consists of the several images to let the patient know how it looks like when explained by the examiner. And lastly, the flip chart is a sturdy sparable flip chart stand that gives flexible standing, so it can be placed on the table without holding it during the consulting the patient.
For strategies of implementation is basically about what method used for implementation and how to reach the targeted individual. Since our targeted individual are among geriatric aged 14 years and above, we decide to reach them through involvement or collaboration with the general practitioner, GP, ophthalmologist and optometrist, which is OD, to give one-to-one health education using the flip chart. This is because one-to-one health education with flip chart will be more effective, focused and personalized, especially for patients that care about the privacy the most. General practitioners who tend to have a larger pool of patients for general health checkup can help to refer the diabetes patient to the ophthalmologist or optometrist for an eye checkup to regularly educate the patient about the diabetic retinopathy. From there, the ophthalmologist and optometrist will explain more about the diabetic retinopathy using the flip chart to increase the knowledge and also the understanding of the patient. In addition, this type of face-to-face health education will increase the patient understanding when the health professional use the local language or layman term. Annual eye examination can also be arranged for early detection of diabetic retinopathy to prevent it from becoming worsening.
Okay, now we move to aim of introducing this tool. So, what are the main purpose in introducing this flip chart as health promotion tool? Okay, firstly, it is to provide knowledge of diabetic retinopathy as a secondary disease of diabetes mellitus among diabetes patients without diabetic retinopathy. Okay, secondly, to give education about prevention of diabetic retinopathy development among diabetic community without diabetic retinopathy aged 40 years old and above within 6 weeks. Therefore, this tool is mainly to educate diabetes patients about diabetic retinopathy in order for yearly prevention. Next, we move to expected outcome. So, what are the goals that we need to achieve from this health promotion tool? And what we expect from the patients after we introduce this flip chart? Firstly, the outcome that we expected is diabetes patients will understand more clearly about diabetic retinopathy, thus increase likely that the patient will adhere to necessary regimens and treatment for the prevention. Okay, next, patient education promotes patient-centered care that will attract diabetes patients to the provider like optometrists and general practitioners. After that, diabetes patient will become more aware of consulting an optometrist for eye checkup, thus reduce the progression of diabetes retinopathy due to secondary illness of diabetes mellitus. Lastly, diabetes patients will ensure continuity of care and reduce complications related to diabetes mellitus from this education.
For the potential benefits of this flip chart towards the eye health or other areas of health and the quality of life, this flip chart is useful to ensure that the patient's education and consultation by the expert can be done more easily and effectively. By enhancing the patient's understanding towards diabetes, their compliance towards diabetes management can be improved, which consequently can prevent the complications of the diabetic eye health problems, especially the diabetic retinopathy. With more effective patient education using the flip chart, the quality of life can also be improved as the patients involuntarily adhere to the diabetes management. The benefits from the improved blood sugar level control may surpass the anticipated intensive self-management burden that are needed to achieve the strict blood sugar level control. Next, the diabetes can also cause depressions and worries among the diabetic patients, as there are unnecessary worries and fears towards diabetes complication and the endless diabetes care, such as monitoring blood sugar level, exercising, healthy eating, quit smoking, and have at least once a year eye examination that can burden them psychologically and financially. Therefore, with the explanation and support from the expert using this flip chart can help patients to cope better with diabetes and lessen their worries and fears.